This is the process, the standard procedure for receiving a patient from the post-anesthesia care unit following orthopedic surgery. In this video, we're going to use the scenario of a left total knee replacement, and we will employ the stop, lock, and roll process, which entails locking the knee portion of the bed, she's going to look at all the cords, all the equipment, hook everything up, paying attention to safety, making sure the cords are not touching the floor or otherwise making it difficult for the patient to move and even posing a fall risk. The patient could trip over cords. Orthopedics involves quite a bit of equipment. Now this is the SCD machine, and this is skip protocol. It's a core measure. It's mechanical DVT prophylaxis, and most of our orthopedic patients will come up on this, and occasionally will also be required to have additional DVT prophylaxis, medicinal DVT prophylaxis. Okay. Now she's going to put the SCDs on. Many times they'll come up with the SCDs already, the boots already on their legs, and it's just a simple matter of connecting them and plugging in the extension. Note the towel roll placed under the ankle. That's the roll portion of the stop, lock, and roll. And what this does is it provides maximum extension, a hyperextension of the leg. And this ensures proper alignment following knee replacement surgery. Now we're going to place the cryo cup. The cryo cup is a machine that provides a cool temperature to the knee or surrounding tissue. Note, there are different types of cryo cups. In this particular model, we have the gray one, and the plastic portion should be the one that goes against the skin or the knee or the dressing. Now that's in place, and that just secures it. These little bands will secure the cryo cup. Now she's going to connect it. Okay, next step. Note, all this while, she's getting a report from the post-anesthesia nurse using SBAR format. That way we don't miss any of the physician's orders. Another thing that's helpful is to go over the orders while in the room. As you can see, the setting is set at the coldest temperature, which is between 40 and 45 degrees Fahrenheit. You can also put your fingers underneath just to ensure that the water is flowing through the machine and that we are getting optimum temperature. Note also, this patient has a pretend on-cue pump. If she actually did have an on-cue pump, since this is our model, you would see a small bulb, and you want to just ensure that the tubing is in place, that there's a dressing on top, and you will note this also on your MAR. Okay, you're going to check the dressing as well at this point. You want to also ensure, while getting a report, that you do neuro checks, pedal pulses, make sure the patient has sensation, are able to wiggle or move feet. If not, you want to pay attention to that. Another good thing to have and keep in mind is to have an overhead trapeze for your orthopedic patient. This is going to enhance functional mobility. They're quite easy to place on the bed. This will help the patient reposition themselves during their stay here in the hospital and give them more independence. And that is how you would receive a post-op knee replacement or orthopedic patient. Thank you.